Hello and welcome to another episode on MFM's podcast, host called Beyond the White Coat, the podcast that takes you on an unforgettable journey into the lives of doctors. I'm Dr. Selina, founder of Medic Footprints Malaysia, a platform that connects doctors to diverse careers in healthcare. If you have not followed our podcast, be sure to hit the follow button and follow our channel. Now, in today's episode, we'll be exploring doctors in tech. Now, with us today, we have Dr. Hanis Hasri, a medical doctor and a subject matter expert for hospital information systems for all hospitals under Ministry of Health in Malaysia. Previously, she was a clinician for 8 years, particularly in the Paediatric department. She has a master's in Health Informatics and has a deep interest in artificial intelligence and digitalising healthcare. Welcome, Dr. Hanis.
Thank you, Dr. Selina.
So, Dr. Hanis, tell us a bit about your journey, your medical journey, because previously you were a clinician in pediatrics and now, suddenly you're in the information system side of the hospital. Humans and machines are completely different things. So tell us how you got into this path.
Okay, actually, my journey in medical world, of course, we started from the medical school and I started my doctor career in 2012. So after went through the housemanship and then the MO-ship, I particularly very interested doing pediatric. I even plan to pursue my master or parallel pathway for pediatric. But unfortunately, along the way, my son diagnosed with mild autism. So we juggle a little bit here and there to manage his appointments and also my study. But then we figure out that it's a very tough journey, and at the same time, I also wanted to focus on his development. So in 2019, I decided to quit clinical because I need to focus on his development. And my superior at that time offered to become the medical officer in charge in the pediatric emergency department in the hospital Tunku Azizah, Kuala Lumpur. So I agreed to the offer and I joined them. So actually, I'm not entirely quit clinical at the point of time because I still doing pediatric and emergency at the same time. But because of at that point of time, our department is very new. So our workforce for medical officer, there's only 4 or 5 of us. So we have to help my specialist to do administrative work and also running on the floor for clinical. So at that time, actually I don't have any background on technology at all. I never thought that I would be in this field. But when you are pushed and to a corner and you don't know what to do, and you have to do everything so that patient can be treated well and in a safely manner. So I think we should have some kind of automation done in the department because doing clinical and also administrative work requires a lot of time and energy as well. So I thought, I should do some automation. So I think I have to learn. So at that time, I just went through online courses. Like in Udemy, just like $5 online courses to learn Excel. I don't know to use Excel at all. I don't know how to put formula at that time, but from the online courses, I learned to know you do the formula, the count if, just to count the working hours, to do roster, to manage assets in the department. And then I think, this is actually a good way because when you automate stuff, you can focus your energy and time to manage patients in clinical. I can have more time doing clinical work because my system already cater for the administrative work. So I further went to boot camps, coding boot camps, and then my interest in technology grow. So I think, and then at that point of time, because uh, subsequently, my time in the department more towards the administrative work and less clinical work. So I think, okay lah, I want to progress. So I asked my head of department, I wanted to do technology and clinical and in health, but I don't know how to proceed. So he introduced me to Dr. Azrin. He is one of the pioneer in digital health in Malaysia. So he told me the thing that I wanted to do is called Health Informatics. I never heard of that, but he asked me to, Google and search for any courses. So okay then I from there on I always went to learn online how to build apps, build websites, and learn more how to use Google Sheets, how to utilize Google Drive, Google Slides to do online simulation during the COVID. And eventually I went and further for my master. Yeah. And because of this, because when I enter master program for health informatics and analytics, my circle that have same interest with me, digital and health, we found the same interest people, right? So they connect me to someone in the Ministry of Health, so that I can join them and some sort of career progress.
Wow, that's a very, very long journey, Dr. Hanis.
Yes.
Sounds like there's a lot of relearning new things.
Yeah, I encounter a lot of bumps and walls because I don't know and I don't know who to ask. I wanted to do this, but at that point of time, no one can tell me except Dr. Azrin. Thankfully, my HOD, Dr. Azamani, he connected me to him. If not, I wouldn't be here, I think.
Okay, what was the biggest challenge you faced? I mean, throughout this journey, I know you said that you were moved to another hospital, and then in this department, you are doing clinical and also administrative tasks. Can you explain more about like the challenges you that you went through to throughout this journey?
Okay, so I think the first challenge that I have to learn I have to self-learn. I have to do my own research, which methods works best to my department because I'm the only one that will do the system, and thankfully, my superior and consultants in my department was very supportive. They really support me. Even there are a lot of failures. Actually, we have to mention the failure lah. There are a lot of failures along the way, but they celebrate the successful parts. So another challenges is how to ensure for our staff to adhere to the new system. For example, a very simple QR code attendance system. How to make sure they really scan the QR code and put in their attendance, and then how to make sure they attended the online simulation program, and how to make sure they really fill up the online roster request form. But you have to do it in a very subtle way that I did this for you. It's not for me. It's for the benefit for everyone. Yeah. But but I'm very grateful everyone is supporting lah.
Okay, tech is a very extremely male-dominated field, and you are the very, very few female doctors I know who know how to code, and who has expertise in this field. So, what is it like, being a female doctor in this health tech sector?
And actually, it's quite fun because my male counterparts, they are very funny and easygoing. Being boys, right? It's a less formal kind of world lah, to be honest. And they really took a good care of me and my friend, who are, I think in my team only 2 female doctors. When we went outstation, only either me alone or my another friend. but they really took a good care of us. I don't feel any uh like suppressed by feeling ridiculed or something. No, they are very supportive. I don't feel uh I don't feel like a scared girl. No, like, I don't think that.
Okay, so here's the thing, right? I wanted to ask, like, many years ago, right? For me, as a doctor, I always thought like, nah, I'm a doctor, and that's all that's important. I don't have to bother to learn anything else outside than medicine or how to treat a patient. That there's that phrase, "Oh, I'm a doctor. I don't need to do any of this." Do you think this still hold true?
Uh, uh, no, I think no. But I think the system is programmed in a way that clinical is the most important part in medical world. Okay, when we were in medical school, everyone is talking, about medical, about clinical, bedside teaching, but no one taught us about how many ventilators you need in one ICU, how many oxygen concentrator you need in acute beds or things like that. Because actually, in order for the uh the front lane to work properly, actually the back end we have to do a lot of work. So for example, in COVID, during COVID pandemic, it really exposed our healthcare system. Uh, I mean that because we need to order PPE, vaccination, and then we have to rearrange human resources. That requires a lot of administrative work in order for the front line to work. The flow can go very smoothly. But thankfully, in our country, we have very good backbone that allow us to, we always have, the apps open. I think it's very quick. We expanded until 9,000 bed in a few weeks or months only, right? So actually, it's a lot of effort. And actually, if you further your study to be to become a specialist, when you are a specialist, you also will be required to do a lot of administrative work. For example, the quality statistic, quality report, and things like that. So it's a new thing, but it is required because you cannot do clinical forever, right? So you have to learn eventually the administrative part.
Wow, so it's very powerful what you just mentioned, because basically patients' care is not only clinical medicine, but there's so much more to it that we
Yes.
don't know.
Yes, correct. There's a lot more. You need someone to order medication for you. You need someone to maintain the system so that you can key in the patient's appointment. That is some basic example.
Okay, why is it important for doctors to learn about tech?
So technology is something that develop very fast in few years. And why people develop tech and put technology in health, because they wanted to solve problems. Okay, so for example, previously you do things manually, you key in appointments patient manually in the small appointment card, but because patient always forget where they put the cards, and then it get lost or in flood, so someone think that, oh, we should have a system that is sustainable, so that we can keep the appointments, so that we can keep track on the appointments record. So that's when the technology come in. So technology, it's not necessarily something very high end. It could be something just like a Google Sheet or Excel. If you put your appointment list inside the Excel, it is considered you are using technology already. But of course, at one point, you will think like, oh, Excel is not enough already. You will want to upgrade and like, it would be better if we have apps, mobile apps for appointments. Mm.
Okay, what's the clinician's role? I mean, you just mentioned that that it's just using a Google Sheet as considered technology. And as a doctor, before I left clinical medicine, I mean, after I left clinical medicine, that's when I realized that I was so backwards. I didn't know how to use Google Sheets. I didn't know how to create a proper presentation. Like there were so many things I didn't know. So, what do you think is the role of a clinician? I mean, what sort of role does a clinician play in form of in health tech, in med tech? What are their roles?
Okay, if there are a lot of roles in medical technology, but particularly if I want to concentrate what my team did, is we become the subject of matter expert of the hospital work process, because the only person that knows how hospital work, how we treat patients, is only clinicians. It's either clinicians, nurses, medical assistants, or whoever in the clinical world. But people in the technology world, they don't know this work process. So for a doctor going into the technology world is to become the center of reference how you work in hospital. So it's very simple, like how we register patient in the emergency department. The way we register patient in the emergency department is not the same as we register patient in the outpatient clinic department. It's not the same. The work process is not the same, and even different facility have different work process. So that's where clinicians come in, step in, and advise the people in technology. Okay, this is what we do, so the system must go this way. This is where they should click so that the system is more user friendly.
Okay, because I did I mean I was talking to a lot of people, and then people from the incubator programs, because we are at Medic Footprints, we're thinking of building a medical incubator program, right, to help nurture all these innovative minds. So I heard something that was really funny. One of the program directors, they said that all the solutions are all built by engineers, because they just realize that, okay, I can build this. But when you ask them what's the problem they're solving, they don't know what the problem is. They just know that they have a solution.
Yes, they don't know how to use it even, and when to use it. Most of the time they don't know. They just, okay, we have this. There is some machine learning program inside the CT scan to detect something. But then when we ask, okay, what kind of patient would require this technology? Okay, what kind of patients would not require? Like if you can diagnose a pneumonia from X-ray, why would you need AI doing CT scan AI to diagnose pneumonia, right? So these are where clinicians comes in to filter when and where to use the technology.
Yeah, I came across one technology. I think it was created in Switzerland. Is to do a UFEM or a urine dipstick of your urine every single day. So, exactly. So, as a clinician, you'll be thinking, why?
Oh, but patient with nephrotic syndrome would need UFEN diet daily, I think.
Yeah, but not a regular healthy person, right?
Oh, okay, no.
Yeah, so this is something that they're selling to regular healthy people. Measure or you check your urine daily, and you'll be like, "Whoa, why are you doing that?"
Yeah, it's the same like nowadays there's a lot uh I found it online, very easily accessible to buy. Now they can people can buy ultrasound to detect fetal heartbeat. So if you want to hear your baby heartbeat, you can just put on your tummy. But I think that is very dangerous to use by non-clinical person, because if you feel that your baby have reduced movement that day, then you put the probe and then like, okay, the heart rate is 120, but it's only like 5 seconds, right? And I think all clinicians know there is no way you know the status of the baby with 5 second heartbeat. You need a long CTG. So yeah, I think that's where we come lah. come in to filter who and when, how to use the technology.
Yeah, so a lot of health tech companies, this is the thing that they all tell me when they are asking for like input from us, right? Oh, this software will replace doctors. So what's your input on that?
It depends on what work process you want to cut for you to use the system. Okay, for example, okay, I give very simple example lah. In my thesis, I did about machine learning algorithm to predict whether when the patient come to the emergency department and register and predict whether this patient is going to be admitted or discharged at the end of the consultation. Okay, so it is mainly to reduce the waiting time and also reduce the and we want to anticipate okay how many beds we will require in the next 2 or 3 hours. Okay, so this is where the technology comes in. Of course, it is to replace the medical assistant or doctors, but it is for the beneficial of everyone, patients and also healthcare providers. So we have to see. So we have to see where this health technology would help in our work process. If we think, and we also have to bear in mind that not necessarily you use technology, your life will become easier. Sometimes your life will become worse because, because now, okay, your work process is, okay, patient came, for example, small clinic lah, patient came, register, ask name, okay, name. Just write, see doctor. Very easy, right? But now if you have system, okay, you have to turn on the computer, you have to log in into the system, and then if the internet is slow, you have to wait. So it becomes a hassle. So sometimes some technology is good in certain place, but the same technology can make the clinical workers' life worse in other places. So we have to have a check and balance.
Okay, so what's your take on like AI in healthcare? How will this affect a doctor's career and their credibility? You know, because sometimes people might, I'm not sure. I'm assuming in the future, when someone goes to the hospital, they'll wonder like, okay, is my result going to be interpreted by a doctor or an AI? So, what's your take on this?
Okay, so first we have to understand what is AI. AI is artificial intelligence and how it works. Okay, so artificial intelligence is a huge umbrella of a machine giving feedback to us user what is happening, and they will be some sort of conditional formatting lah. I always told my friend, okay, actually conditional formatting is simple AI. You put rules. If it's like this, you color red. If like this, you color green. It's actually a simple AI already. Okay, so you have to cater, okay, which level of AI you want to use in your system, in your facility. So if we talk more deep further on machine learning, means that maybe the machine can replace doctors, and then we have to ask ourselves, okay, if the machine, for example, I think nowadays the radiologists, radiology specialists, they think, oh, the CT scan can detect TB, the mammogram can detect breast cancer. No need the eye of the radiology anymore. So in order for if we feel threatened to this technology, we have to make an effort to make ourselves relevant by not being feel inferior to this technology, but you have to learn, and you have to learn and push yourself forward. How you want to leverage this technology to give better service to your patient. Maybe because the machine can help you detect breast cancer faster than you, then you can use that, and you can see the patient in your clinic, radiology clinic. Maybe nowadays I don't think we have radiology clinic. Radiologists consulted a patient, right? I never heard of any lah. Always the clinical, right? But then maybe I don't know. This just come into my mind. Maybe in the future, radiologists can they can open clinic. Okay, this is the machine learning, give this result, and this is what I think based on your current condition, and then they can have more human doctor and patient relationship would be better. But I know it's the now it's the booming of ChatGPT. Everyone feel like, oh, students can use ChatGPT to make their exam essay and something. But the world move very fast, so you have to move fast also lah with the technology. If you don't want, then you have to think, how to make yourself relevant in this industry, or not in this industry, in other industry.
Wow, I guess,
I answer your question.
yeah, I guess because becoming relevant is something that we are definitely not taught in med school, definitely not taught during our clinical training. We just, if I'm going to recall my medical school, I'm going to recall all my trainings in the hospital. No one told me that I need to keep updated with technology, so that I can be relevant. And when you're in clinical setting, right? Everyone thinks like you, everyone behaves like you, everyone knows what you know. So nobody really looks outside beyond the walls of the hospital. What's happening outside, and what do you need to learn to adopt in your practices so that you can, keep up with pace? Because, like you said, right, everything is moving so fast, and it's a wave. Either you catch it or you lose it, right?
Yes. Yes.
Okay.
Correct.
So, Anis, what do you do? I mean, tell me a bit more about your work. What's your role with what you're doing as a subject matter expert?
Okay, so actually, digital health umbrella is very big, like I mentioned earlier. So it's either you use technology in clinic kesihatan, or hospital, or maybe like My Sejahtera, they have their own team. So actually, in the ministry, it's not only my team. There's a lot of team that people don't know. So particularly my team, we are focusing on digitalizing healthcare system in hospital. So we have I don't remember how many percent of our hospital is still manual. So we go to this hospital and some sort of put system inside there. So to put the system inside a hospital means that there will be a change of work process in the hospital from manual to using a system to digitalize your workflow. So before this, you use pen and paper. Now you have to use computer. Or we also go to hospital where we have to upgrade and change the system because the previous system is obsolete already. We cannot upgrade it already because the technology is upgrading, right? So you cannot use the previous system. We have to change the system. So how we change the system? We have to go there also and give advice to the hospital about change management, to the value stream mapping. Yeah, so this is we as a subject of matter expert comes in, and we also involved in the development of the modules in the system. So, for example, currently we have our own homegrown system, HIS at KKM, where all the modules inside were built based on the requirements from all the head of services in Malaysia. So, for example, ONG give their own requirement, orthopedics give their own requirement, what they want in the system. So we become the bridge and we bring the clinicians' input and we talk to the coders, what we wanted in the system.
So you are like a translator, would you say?
Yes, yeah, and a bridge. I will say, okay, we are a bridge. What you want? What you want, doctor? Okay, then I go talk to the coders, like, they want like this, so how about you do this? So sometimes we give advice to them, where to change, where sometimes it looks like a small requirement, but then actually you have to go back to the back end and move around some certain things to improve the system, things like that lah. Because the doctor always say, I want this one only. I don't care. Yeah.
Okay, yeah, because I've dealt with developers, and it feels like they are not they don't speak English. I cannot understand when we talk. It's like chicken and duck talking. I'm saying this, and they say cannot, and you turn around, you say something else, which means the same thing, and then suddenly can.
Because I think we have to understand how the coder's brain works. I think it is just how they were taught, and that's how they can code. If they don't think that way, they cannot do the coding. So we really have to be, like black and white and very thorough. And sometimes we do all the work process from A to Z. We prepare everything, then only we pass to them. If we put like this a little bit, this one a little bit, it's quite difficult. So this is where we as a clinicians come in. You don't have to be someone like me, have a digital health or technology background. It could be anyone. Even the champion in the hospital can, give better input than me because he knows the work process better than me.
Okay, so what are the challenges for you when you go to the hospitals? Are they very apprehensive to accepting technology?
It depends, and depends on luck as well, I think. Yeah, it depends how welcoming they are. And then sometimes in the hospital they have, different different thinking, they want it this way, they want it that way. But we people from the headquarters, we have to tell them, okay, we have the GHOP, General Hospital Operating Policy. So whatever you want to do must adhere to this GHOP ICT, okay? So that's why we like align everyone. This is what you have to do. Okay, this one want A plus B, this one want B plus C, okay. We have to, so our role is to become like, make everyone align. It's quite it's difficult lah actually, and it requires a lot of time also. You cannot just go once and then okay. So you have to go multiple times.
Okay, so if a doctor wants to do what you're doing, how can they, what do they have to do to get, what are the steps they need to take?
Okay, so digital health, like I mentioned earlier, technology is used for you to solve problem. If you are someone that like to solve problem and have very high enthusiasm to self-learning, then I think you just follow your passion. Things will come to you. Yeah, this is what I think. Things will come to you. You may feel alone or no one understand what I'm talking about. Like I felt that way lah few years ago, but I'm very lucky to have everyone supporting me. But if you feel no one supporting you, you just do whatever you can at the moment. Okay, sorry. Okay, sorry for that. So you just do. So for example, I want to do technology. So you find something that you can think of, what you can create to improve the work process of your current work.
Yeah, so how can doctors get to, if a doctor wants to follow your footsteps, what can they do?
So my footstep means digital and health, right? So if you don't know what you want to do, like I mentioned earlier, technology is something to improve your work process and your life. Okay, so you find a problem, go find a problem and try to solve it using technology. Whether it's just a simple Excel, it's just a simple Google Sheet, don't care. Just start from there. Anything that they can do it for free, like no, you don't have to pay anything at all. Okay, just start with that, and then eventually it will grow. Eventually you will start thinking, oh, if I know these things would be better, then you will start learn more. You will build up your knowledge. So start something, you find a problem, you start with something, and then you just follow your path. then I think then for me the opportunity will come. Then you will find, then you will widen your circle. Then you will find people with same interest with you, because when you doing your research, you know how to do your apps. For example, when you Google things in online, then you find people with similar interests with you. Then you connect with them.
Okay. So if say a houseman, for instance, this person went into med school thinking that, oh yeah, actually I do want to be a doctor, till they come out. A lot of them come out and then they become housemen and they realize that, oh no, I don't want to do medicine. Would you recommend them to, get into digital health?
A digital health requires someone that have interest. Even though I don't have interest at the beginning, but what to say, they can try lah. They can try. I would suggest to them, if they don't know what they want to do, I would suggest, okay, why don't you try and learn? Because digital health is entirely different world. It's like a different pole, north and south, west and east is totally a different pole. But if you can come into the digital health world, or you will be wanted everywhere, I can say that. People would want a doctor with technical knowledge. I would recommend them to explore this field, but I think the passion have to come from them also.
Can you explain when you said the companies actually want doctors with technical knowledge?
Mainly, so it depends on if the hospital wanted to grow and use data, especially now it's the big data world. If the company wanted to use data and understand the data insight, they would want clinicians with this data analytics knowledge to interpret the data. Like how long the patient with this certain condition will stay in the hospital, to predict the length of hospital stay, and also the cost that the patient have to bear when they have this condition to stay in the private hospital, or even in the government hospital. Actually, we are doing that also. So people out there, they have more awareness on big data. At the moment, they are exploring this field. So currently, I don't find so many that hiring doctors with this background. I saw they hire most are like someone with a computer science background go into this health big data field. They don't find doctor particularly. But if you're a clinician and you can prove that you can understand and explain the data insight, then your value will become very high, because it's not easy to find. So computer science with health data background, I think there's a lot. But doctors with health data background is not many. Very, very minimal lah.
Oh, that's very, very profound. Okay, last question. Do you miss clinical medicine at all?
Yes, actually, I think clinical is I don't say easier, but I think it's easier to learn clinician with clinical, because I see patient and I have some fun time with them, treating them and then seeing them very well, become well, or maybe not so well. But the feeling of fulfillment is there doing clinical, because in digital health, it's you become fulfilled when the hospital work processes become better. So for example, I think last week or last 2 weeks, we went to hospital Kuala Lumpur to integrate their X-ray machines modalities to our cloud-based system. And then they use it and they are very happy, because previously they have to print thousands of films physical films every day, right? So to see that happy to use that is such a fulfillment for us.
Okay, well, thanks, Hanis. Dr. Hanis, it's very insightful listening to you because, doctors, technology, we don't jive. It's two opposite end. And it's very nice to see like
Yeah,
a female doctor who's saying that, no, you can still bring a human element into it.
actually, I think the main reason I wanted to dive into this field, I just remember, I wanted to work from home actually because of my son condition, but then actually I work everywhere. You are required to be on the field most of the time because you want to go there, go dive down at the field and understand their work process, their difficulties, and how these technologies can help them. Sometimes it's like, okay, you can use this system this way, it will help you. Then, but maybe we go to other facility and say, oh, I think you better go manual lah. Yeah, it's better for you, I think, at this moment. For example, network very bad. When you want to push for system, like you will make your work process slower. But it's very interesting to see a lot of people. But actually, I wanted to work from home, but now I work everywhere.
All right. Thanks, Hanis. Thanks for sharing. And thank you, everyone, for tuning in to this episode of Post Call Beyond the White Coat, brought to you by Medic Footprints Malaysia. We hope you enjoyed our discussion with Dr. Hanis on digital health.
Thank you, Dr. Selina, for inviting me. Thank you, everyone. Hope everyone have a good day ahead and explore digital health and don't be scared. Okay, try to explore, try to solve problem with a very simple technology and then go from there. Okay, thank you.
Thank you.